Hello everyone, welcome to Dental Mate. Today in this video we'll be discussing the diagnosis of COVID-19 disease. So let's get started. Okay, so before we talk about the diagnosis or the lab investigations carried out in COVID-19 disease, let us first understand sample collection. So, CDC recommends upper respiratory tract sample. It could be a nasopharyngeal swab or OP, that is a oropharyngeal swab. In severe stage of COVID-19 disease, bronchiolo-alveolar swab or bronchiolo-alveolar lavage can be taken. After sample collection comes specimen handling, storing and shipping. If we talk about handling, then the specimen must be immediately transferred or the swab must be immediately transferred into a sterile transport tube with 2 to 3 mm of the viral transport media. Next, if we talk about storing, then the respiratory sample can be stored for 3 days, that is 72 hours at 2 to 8 degrees Celsius. Okay, now if we talk about lab investigations, then there could be 5 different types of lab investigations that could be carried out. The first one is the basic blood investigation. If we talk about the findings of the basic blood investigation, then there is decreased WBC count, there is decrease in the lymphocyte count, which is the most common finding. Then there is decrease in the WBC count. Also, there is increase in prothrombin time, increase in the D-dimer levels, and increase in AST, ALT, LDH, and C-reactive protein. Now, these 4 components are increased if the heart, liver, kidney, and other organs are involved. Next up are the diagnostic tests. It could be, diagnosis can be made up of the past infection also and the present infection also. If we talk about past infection, then there is antibody or serology test in which antibodies such as IgG, IgA and IgM can be diagnosed. But of much more concern is the diagnosis of current infection or present infection. First up could be the rapid antigen test, and next is the nucleic acid amplification test or the NAT. This includes RT-PCR, that is the gold standard for the diagnosis of COVID-19 disease, TrueNAT or CBNAT. WHO defines RT-PCR positive case as COVID-19 confirmed case if a person has shown positive result in RT-PCR. That means that is a COVID-19 positive patient, irrespective of the clinical signs and symptoms. Whatever signs and symptoms could be seen, whether they are present or absent. If a person is RT-PCR positive, then that is a COVID positive patient. Next could be chest X-ray, lung ultrasound or point of care ultrasound, that is POCUS. High resolution CT scan of chest. Now, if we talk about the lab findings which are seen in severe COVID-19 disease, then we can see that there is elevation in D-dimer levels from normal range, which could be or which is usually less than 500 nanograms per milliliter to more than 1000 nanograms per milliliter. As I have told you already in previous video, that D-dimer is a fibrin degradation product which increases in COVID-19 patients. Next is CRP or the C-reactive protein, which is an acute phase reactant, and increase in its level would indicate inflammation. So here in COVID-19 disease, its value is more than 100 milligrams per liter, whereas normal range should be less than 8 milligrams per liter. Next up is the LDH, that is the lactate dehydrogenase, whose value is more than 225 per liter, more than 225 units per liter, whereas in normal range it is somewhere between 110 to 210 units per liter. This enzyme is present in almost all the cells. It catalyzes the conversion of NADT to NADH and back. So increase in its value would basically signify tissue damage. Next is troponin, which is present in heart muscles. So increase in the level of these proteins signifies that there is damage to the heart muscles. The normal range for troponin T, high sensitivity in females, is ranging from 0 to 9 nanograms per liter to 0 to 14 nanograms per liter in males, whereas it is more than 2 times the upper normal limit in COVID-19 patients. Next is ferritin. So ferritin is a blood protein that stores iron. It is a marker of inflammation. Its value increases to more than 500 micrograms in patients from a normal range of 10 to 20 micrograms per liter in females and 30 to 300 micrograms per liter in males. Okay, after that is CPK, that is creatinine phosphokinase, which is an enzyme which is present in heart, brain, skeletal muscles. High CPK values suggest that there is injury or stress to these tissues, that is the heart, brain and skeletal muscle. Its normal range is between 40 to 150 units per liter, whereas in COVID-19 disease it increases to 2 times the upper normal limit. And the absolute lymphocyte count decreases to less than 800 microliters, with 1800 to 7700 per microliter being the normal range for 21 years old patients. So, one thing we must remember that in severe COVID-19 cases, there is increase in D-dimer, C-reactive protein, LDH, troponin, ferritin, and CPK, whereas there is decrease in the lymphocyte count. So this is it about the lab diagnosis. In the coming videos, we'll be discussing in detail the rapid antigen test, RT-PCR test, what are the radiological or radiographic findings seen in COVID-19 patients. So stay tuned, keep visiting. Thank you.